Well, last month was the hottest month of the year so far, and that extreme heat can take a toll on our health. And here to tell us about how heat affects us is University of Maryland School of Medicine professor, physician, and Forbes contributor, Dr. Omer Awan. And good morning, doctor. Thanks for joining us.
Good morning. Thank you so much for having me.
All right, so tell us, when does heat really begin to affect us in a negative way? I mean, is there a temperature at which we just really shouldn't go outside?
Well, there's no specific temperature, Melanie, but honestly, the hotter it is outside, the harder it is for our bodies to get rid of that heat and stay cool. So, you can experience certain heat-related illnesses like heat exhaustion, heat stroke. Certainly when your temperature rises above 104 degrees, you're at risk for having heat stroke. And that's a serious life-threatening condition. You may start to be confused. You may forget the time, where you are, and worse, you may even lose consciousness. So if you have any symptoms of confusion, headache, muscle cramps, you must seek medical attention and go to the emergency room.
All right, before we get to that point, are there some symptoms we should watch for when we're at risk of getting overheated?
Absolutely. So heat exhaustion, which is not as serious as heat stroke, you may have headaches, you may have muscle cramps, you may be tired. Your temperature may even be normal, but it may be slightly above what it should be, but certainly not 104 degrees. But heat stroke, when you have a temperature that's more than 104 degrees, look for confusion, delirium, inability to, form normal sentences, maybe losing consciousness. These are all very serious symptoms that require medical attention.
And we all know how uncomfortable it feels when it's so humid and hot outside and we're sweating and we're just, it's nasty. But are there some long-term and short-term effects of heat on our health?
Absolutely. So, in the short term, it can really result in our inability to function in terms of us being confused, us not knowing where we are, being disoriented. But, studies have also shown that, heat also plays a role in causing strain in certain parts of our body. So, for example, our heart has to work harder when it's hot. So our heart rate, you notice, will increase. You may notice that it's harder to breathe when there's heat outside. So all these things can pose a risk, especially if you already have predisposing conditions like asthma, chronic obstructive lung disease. It can exacerbate that. And heat can also put you at a greater risk for even having a heart attack because your heart is working so much harder. So all these things are really important to consider in heat-related illnesses.
And what about other populations like younger kids, maybe some seniors or kids that are in sports? I mean, do you have concerns about those populations?
Yeah, I'm so happy you asked me that, Melanie, because certain populations are more at risk for heat-related illnesses. Those children, adults that are 65 years of age and older, and even those that work in, heat areas like construction workers. So, those patients are more predisposed to having these heat-related illnesses. And the fact of the matter is that patients that come from low income, like communities and families that come from low income, disproportionately have heat-related illnesses because they don't have access to some of these resources like, clean water, AC, some of the things that we all take for granted.
All right, Dr. Omer Awan with the University of Maryland School of Medicine. We appreciate your good information today. Thank you.
Thank you.